So Hal, thank you for agreeing to be part of this interview, and I hope you're keeping safe wherever you are.
Thank you for having me, Pascal. It's really nice to be here, and I'm hiding out in the mountains of Colorado, enjoying the views and staying out of large crowds. And it's very interesting to see our local community respond with the proper social distancing and masks. It's been quite an experience.
My first question is really about all of the conversations that HIMSS has had over the last few months with different governments, different key stakeholders. We've basically tried to do a tour around the world to see what were the national strategies around building the most efficient response to the COVID-19 outbreak. So we visited a lot of places, we talked to a lot of people, and I wanted to know, in your view, what do you think are the key ingredients of a robust response?
And as you said, this has been a global response, and no one saw the pandemic coming, obviously, and the scale and the speed of it. So really, we've seen, I think, several things going on. First of all, quick responses, throwing a lot of solutions and changes against the wall, if you would, to see what was going to stick. But in the end, as people have gained experience, it always gets broken down into three buckets of people, of process, and technology. So first and foremost, we've seen a tremendous increase in the use of digital health, in the responsiveness. We've seen changes in reimbursement models and government regulations in order to allow it. We've seen cultural shifts of very big levels where suddenly, and we'll talk about this in many of the sessions that are here, of course, at HIMSS Digital Europe. And so what we're really beginning to recognize is that the best responses have been coordination of data, redesign of the care delivery pathways in order to incorporate digital capabilities so people can connect with physicians and clinicians, rapid response in terms of testing capabilities and contact tracking, again, another use of digital responsiveness and capabilities. And that regulatory relief, the evidence-based information that we're seeing being brought forward, the responsiveness of the WHO and redesigning their back-end system for faster information. These are the fundamental ingredients. And so you're seeing innovation, culture change, and redesign of end-to-end processes that are taking place. And each environment's unique. It all starts with where were you? And what capabilities do you have? And then many of the technical and process solutions that come behind it really are based on your starting point.
Well, one thing that you just said is that in some cases, COVID-19 has fast-tracked the integration of digital solutions into care protocols. And we've also talked a lot about the importance of digital maturity. I remember a few years ago, it was quite a new topic. But now with this crisis, we understand that having a digitally mature health system helps in many ways. So I'd like to know, how would you define digital maturity? And in what way is it helping health systems to build their resilience in the midst of a health crisis like the one that we're knowing now?
Well, this is a profound question. It goes deeper than the sum of the parts, if you would. So if you go back just a little bit and you look at all of the incredible maturity models that HIMSS has brought forward, such as electronic medical record maturity model, continuous care, analytics, the way we use information, et cetera. These are individual pieces that are foundations or components of digital infrastructure or digital capabilities. But when we talk about the maturity, the digital maturity of an entire system, it goes across the spectrum from the beginning of a point where a patient doesn't feel well all the way to the point of discharge. And how do we utilize all these tools? How do we understand these dependencies? So creating a digital maturity model, if you would, or in our case at HIMSS, what we've been developing is actually called a digital maturity indicator, really takes over 1,200 different data points that looks at everything from not just the technology, but more importantly, how is it deployed? And when you're measuring an individual system, it's not just the pieces, it's also the workforce and how well are they trained and how do they interface? How do they exchange information? Are they used to taking data outside the fabric of the clinic or the hospital and bringing it to the inside, right? Outside in measurement. So when we start to think about fundamental maturity models, it now also includes supply chain. Supply chain was something that was simply not in our world before. It was something that was on the outside, but how critical when you think about COVID-19 has supply chain been in the management of this crisis? And this is something that most systems never really looked at. We thought of supply chain largely as how much did a widget cost? Not where did it come from? What happens if it's interrupted? How quickly do I scale up? So bringing all of these pieces together to be able to interact with population health tools and data, individual data, workforce development, and all of the sub pieces in our classic maturity models, these all have to get combined to be able to measure a maturity of an actual system and where it's progressing. And then finally, take the sum of all that and put it against outcomes. Because if we have all these pieces, but we're not measuring how they combine in order to produce superior outcomes at the patient level and at the system level, then we actually are missing the boat. And I think that's been the biggest development in the maturity model and the digital maturity indicators, if you would, across systems and hospitals, which is really getting the return on the investment and measuring it.
And we see a direct correlation between maturity and what we could call resilience or preparedness.
I think we're getting there. What we've seen, because people threw so many different solutions simultaneously during COVID-19, and they've changed their processes so much in the last 6 months in order to accommodate the pandemic. This new normal has started to be created, and now they're going back and measuring what was more effective at one type of effort like telehealth versus another. How did the connectivity work? Where did we explore home monitoring? How did that data get fed back into the system and what was the return? And I think a new economy, if you would, an economic value proposition is being created in healthcare because of those changes.
Well, we talked a little bit about the technologies that were fast-tracked. Telehealth is a perfect example. There's nothing new about it. I think we trace the first telehealth consultation to, I think, the 19th century. It was a phone conversation, but still it was telehealth.
Yep.
So it's certainly not new, but somehow COVID-19 is opening a lot of doors and making things happen when it seemed like it was impossible to implement telehealth in some regions of the world. Why is it that we needed a crisis like this one to accelerate something that should be, as normal as telehealth?
Yeah, listen, it's one word. It's culture. No more and no less. We have been for years in the healthcare ecosystem working very hard to bring digital health and items like telehealth forward, device use, remote monitoring, and all of these capabilities of data exchange. And the blockage fundamentally has been on the culture side. Hospitals, hospital systems, groups of clinicians, change is very hard, and healthcare has always lagged in its ability to change quickly. And in fact, we work very hard not to change quickly because of health and safety concerns. even though the technologies we've all mentioned are very well proven and extraordinarily safe, but it's a culture change. The pandemic created not only the opportunity, but the absolute need to adopt digital health capabilities, tools, and solutions in order to solve general healthcare problems that could no longer be managed in the clinic or in the hospital because they were restricted in terms of access. And that culture change has opened up amazing new doors. We have seen systems, and in the opening session, it was mentioned from 30 to 40 times the volume in telehealth has exploded since the pandemic occurred. And many people who were against it culturally have suddenly found out, you know what? This actually works. And they have begun to take the pathways that existed before. They were all face-to-face encounter-based pathways, care pathways, and begun to use telehealth. And they're finding out it's efficient, it can be extraordinarily helpful, and frankly, the consumer loves it. And the consumer, patient, citizen has been demanding it for years. So that is an incredible barrier that we've shot through.
I couldn't agree more. So I've been organizing conferences about health, IT, and healthcare but it was the first time during this outbreak that I had a telehealth consultation. And I certainly appreciated it, and I don't want to go back to having to set up a meeting and take 20 minutes to go to my doctor and then come back. What are the chances that this will stay in mainstream care? What are the chances that my communications with my doctor will be online? Because it's been proven to be effective.
Yeah, I don't think, Pascal, I don't think that any single system will go back to the way it was, even if its most ardent supporters are demanding it, and largely because we've already made the change. And let's use this conference as a perfect example. This original conference, of course, was going to be an in-person event with maybe a little bit of sprinkling of digital interfaces going on and some things that would pop up on the phone. Today, this 2020 event is all virtual. It's all online. We have found new ways to connect it. Will we go back as soon as we can to a face-to-face event? Of course we will, because social gatherings and social connectivity is a natural part of our human existence. But we can be absolutely assured that we will have a very robust and very vibrant virtual environment to accompany it in the future. And so I think you'll also see the same thing happening in many industries, and especially in our ecosystem, that we'll go back as much as we can and need to our face-to-face encounters. But there will be a robust virtual digital health component of it. And now that we've broken through many of the cultural barriers, we'll see systems continue to adapt and integrate. And by the way, this is an impending necessity. We still have our aging population, we still have the disease burden, and we have all been fighting in our systems around the world to have adequate coverage from an employee, from a staff, from a clinician standpoint. And those gaps are growing. We simply don't have enough. So we're going to use these digital technologies to deliver fundamental care. This has just been an extraordinary accelerator.
COVID-19 has revealed some vulnerabilities in health systems, but also in society in general. So I want to spend a little time on these cracks in the system, or these flaws that we need to work on, that were exacerbated by the current outbreak. We keep hearing expressions like when COVID-19 is over and when we get back to normal. In your view, do we really want to go back to normal, or is there a better normal that we should aim for?
Yeah, well, I think, we've started touching on it. There's a whole new normal, which is in our front-facing view of the world and where it's going. Let's just talk about information, and let's talk a little bit about the data and the accompaniment that comes with it. We were caught globally with disconnected data systems from a population health standpoint. We couldn't pinpoint the number of cases. We've been collecting data through phone calls. We've been collecting data in pieces. And what we've come to realize, and Europe's a fantastic example, is that there are no borders when it comes to a virus. It doesn't care. And the ability to collect data and information just in time, and I'll use just in time instead of real time, but just in time data is critical in managing pandemics. It's critical in managing an individual patient. I need to be able to send a patient across a parking lot and have their information go with them. That's a singular example. But I think the new normal will be a completely improved environment, if you would, that allows for digital capabilities, mobile technologies and devices, and the information that they contain being integrated to create a whole picture of the individual. Because social determinants are a critical part of my health environment, my individual habits, how much I walk each day. What are the things happening when I'm not in front of a physician for that 20-minute space? And then we also have recognized, I think through COVID-19, the inequities that are sitting inside all of our systems. Access, quality. You can live in the shadow of an amazing hospital, but you may not be able to get into it. And if you're in a rural region or a region that lacks the resources to have close by physician care, again, these inequities are capable for us to be able to come back and return. So there's no going back. I think it's been unleashed. The question will be, can we remove any of the regulatory boundaries, many of which have already been pulled aside during COVID-19, and not have them go straight back into place to restrict this level of access and information? And by the way, all of that has to be done in a secure way for the individual. We want to maintain individuals' records privacy as well as their secure holding. But the aggregate information is desperately needed from a population health standpoint. So all of these pieces are coming together right now, and they're going to create it. And I also appreciated your last point about vulnerabilities. The last piece is this: access to care. It's not a privilege. It's a fundamental right. And systems have struggled to keep up with the improvements of those rights to their citizens, no matter what country you're in. Sometimes you can be in a space of universal care, but you may not have all the access that you would like to have as an individual citizen. It's a resource gap. Digital health helps close that gap.
So we're talking here from the point of view of the users, of the consumers, of citizens in general. I'm wondering about another vulnerability of the system, which is the workforce. And the fact that I know in France we had demonstrations before COVID-19 because the ICUs were already overextended. The emergency departments could not deal with the demand. And then COVID-19 happened. And then we really pushed the workforce to its limits.
Yes.
And I'm wondering if, first of all, there's something that you'd like to say to them on behalf of HIMSS, knowing that many doctors and many nurses have died even on the front line. So what are the lessons learned for the health systems around workforce, and what message would you like to give to them?
Well, first and foremost, to all of our frontline workers who today, yesterday, and from the beginning of this pandemic have shown incredible courage, passion, And the fundamental belief and understanding that every hour that they've spent taking care of people without regard to their personal safety and life, because in so many cases, we didn't have the proper equipment from day one. We didn't have the proper mask available. We've been reusing things we normally wouldn't be reusing, where our systems were overwhelmed. These are heroes. These are heroes in every single corner. And by the way, it's not only these frontline clinicians, but every administrator behind them, every person who's got to disinfect the room behind them, every person who's handling the entrance coming in. It's our ambulance drivers. It is every single component of the ecosystem has been stretched beyond belief. And so to each and every one of those heroes, we just simply say thank you. And we owe a massive debt of gratitude. Now, how do we repay that gratitude? Well, to your point, these systems were overstressed in the first place. And we cannot continue the way we have delivered care through the years of thin resources and keeping it within an encounter-based paradigm. That's what's been stressing the system. Digital health can help relieve that. It will not solve the problem. We have a growing gap, almost 13 million worker gap in the next 5 years alone, according to the WHO figures on a global basis. That is a huge amount. We have tens of thousands, hundreds of thousands of doctors retiring in the next 10 years for primary care alone across the globe, and no one coming behind them to replace them while we have an aging population that lives longer. So the best way that we can absolutely repay these heroes is to get the pressure off of them to take care of individuals electronically where it's responsible to do so, to improve the supply chain behind it so they have the equipment they need when they need it, and for goodness sakes, get them the information that they need about the individual and the people that they're treating just in time, so that we don't have to waste time getting history background or putting them into care pathways that we find out later they had, because they were unconscious, that maybe they had an issue with a particular drug or medication that would be normal practice. We have to pull away. Let's give these workers a break and give them the information and the tools they need.
Well, these are some of the topics that we will discuss at HIMSS and Health 2.0 Europe Digital, which is going to take place on September 7th through the 11th. You're an important part of that meeting. And so my last question is simply, what are you most looking for?
This is going to be an incredible event. I know we've already surpassed the expectations in terms of people signing up, and the interest in the panels that are going to be vibrant or important. But here's what I'm listening for. And you've touched on it, and we both have. What is the new norm going to be? How do we take what has been an incredibly crippling pandemic and turn it into good on behalf of the ecosystem? Where do we need to improve and accelerate digital health capabilities, digital maturity indicators, our models, to make sure that we're giving the right guidance and feedback to the system so they can take care of their populations? How are we going to look for the inequities, the social determinants that need to be integrated into our pathways more completely so we get the entire profile of where our populations are going? How are we going to fix our broken back-end systems for data and information, both at the individual and the population level? And what is that general attitude of go forward instead of go back? That's the tone that I'm listening for, because I think we all recognize there will be some that want to go back to something that felt familiar, but it's a new world. And so how do we accelerate that new world? And in the phrases that many of us have used in different ways, never waste a good crisis. And this has been a massive crisis, and our responsibility is to make sure that we utilize it to the good of every individual. And that gets into the theme and to the fundamental view of what HIMSS is all about. Um, our vision is to realize the full health potential of every human everywhere. And digital health is one of those means to do it. So we're going to push on it. And I think we're going to listen for it. And I hope every one of our speakers and moderators ask these questions so that it's front and center.
Well, thank you very much. I think the sentence you just said, don't waste a crisis, resonates very much with what we're trying to do.